In today's quick video, let's discuss DHEA. Let's dive in. So DHEA, along with DHEA sulfate, is a naturally produced steroid hormone. It is primarily produced in the adrenal gland, but it also can be produced in the brain as well as in the gonads, so the ovaries and the testes. So DHEA is also a precursor to our other hormones such as testosterone and estrogen. So having enough DHEA around is important in producing those hormones as well. But it is also known as a neurosteroid as well, meaning it has some activity in the brain. And we often see relationships with lower DHEA with things like depression, anxiety, and even the development of things like Alzheimer's. Another thing we think DHEA might be doing is actually counterbalancing the effects of cortisol. Now, I've done a deep dive onto the hormones of stress, so if you want to check that video out, I'll leave a link down in the description box below. And again, I'm saying we think because some of the studies are conflicting and there just isn't a lot of research, but again, acting as kind of a counterpoint to cortisol, we think it can actually help improve insulin sensitivity as well, and also kind of modulate both inflammation and the immune system response. DHEA has been more studied or more prevalent recently as being used as an anti-aging hormone. Now, the problem with DHEA supplementation is that there just is not a lot of good research out there. Like I said, it's being used clinically for a number of different conditions, especially to do with anti-aging, and that is really because DHEA levels generally decrease as we age. So the idea behind that is that if it's going down, let's give some more of it. But again, the studies are not quite clear what type of anti-aging effects it actually has, if any. One of the areas where it's pretty agreed upon for supplementation is with something like adrenal insufficiency. Now, this is not adrenal fatigue or HPA axis dysfunction. This is actually a clinical diagnosis, or also known as Addison's disease. Another area in which DHEA supplementation is getting more research and has some actual clinical benefit is with postmenopausal women who are suffering from osteoporosis or a loss of bone mineral density. It has been shown in a number of studies that adding in DHEA supplementation for this population can actually help to increase your bone mineral density. And generally that will go along with things like calcium and vitamin D supplementation. Another area in which DHEA is being studied and sometimes being used is for cognition, or also things like, again, Alzheimer's or other types of dementia, and even in some cases depression. And again, we think that it may have some benefit because of its use as a neurosteroid, but the studies are conflicting or just don't exist. So this is a promising supplement. Even though it's a naturally produced hormone, we do know it declines as we age, but we don't really know the effects of long-term supplementation with either DHEA or DHEA sulfate. And also, this is one considered to be more of an anabolic steroid. So if you are competing like NCAA, it's actually banned. So just might want to note that. Generally, dosages are going to range anywhere from kind of 5 milligrams. I've seen up to 100 milligrams daily, but usually it's something that is titrated up. Now, here in the US, it is available over the counter, and some practitioners will actually recommend that you go to a compounding pharmacy to get this, just because you want to make sure that the dosage is correct, because again, it is actually a hormone. How do I use DHEA? I've actually used this one in postmenopausal women, again, suffering from loss of bone mineral density or osteoporosis, who also, when we do any testing, have a lower level of DHEA, and it has been helpful in increasing their bone mineral density when they go and recheck for the DEXA. And again, I also have used this in patients where I'm doing some sort of testing for their DHEA levels, and I'm also working with their insulin sensitivity or glucose and their lipids, and I have seen it be helpful in combination with some of those other factors. So again, more research is needed on this one, but it has some promising effects. So let me know if you have any experience with DHEA supplementation, or if you have any questions down below. All right, I'll see you in the next video. Bye.